Good afternoon and welcome to Webinar Wednesday. Today we are joined by Vangie Dennis, consultant for Perioperative Consulting, and Patti Owens, consultant for AestheticMed Consulting International. Both Vangie and Patti have extensive experience in the field of medical safety programs and laser safety, and they both provide valuable consultation services. Today's webinar is a teaser for a special virtual training course on medical laser safety on September the 27th and 28th, which will be led by Vangie and Patti. So for more details, please visit medicallasersafety.com and listen to the webinar. So just a quick reminder about our fall MD Expo, which will be held at the Renaissance Dallas Addison Hotel in Texas from November the 10th to the 12th. Please join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more information and registration details, please visit mdexposure.com. Okay, today's webinar, as usual, is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be wrapping up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenters today are Vangie and Patti. So Vangie, you may begin whenever you're ready.
Thank you so much. Today's lecture is like Linda said, is a teaser. It's laser safety, healthcare technology, and an overview of the expectations if you're going to be a laser safety officer, medical laser safety officer, or helping to administratively run that program. So thank you so much for taking time out of your day today. Trying to advance the next slide. So just a little bit about my background. I was a medical laser safety officer. I am certified over 22 hospitals at WellStar, as well as Emory, over the Emory clinics, and then worked very collaboratively, which was a great opportunity to learn even more for the university system when they were doing a lot of research. I sit on the board of commissions for the Board of Laser Safety, past nominating committee advisor, as well as past president of National AORN. I have received the 1996 Excellence Award for the American Society, the 2011 James Roxwell Award for Outstanding Achievement, as well as in perioperative education, as well as the recipient for Distinguished Nurse of the Year for the Georgia March of Dimes. I am a fellow for the Association of Perioperative Nurses, as well as just completed my fellowship for the Academy of Nursing. And in short, I have been teaching with Patti for over 30 years and been a laser safety officer in every one of my organizations that I've been employed with. And my co-presenter today, who will also be presenting with me for the 27th and 28th course in September. Pretty extensive course, medical laser safety officer course. But you know, if you're not a laser safety officer, I still encourage attending. It gives you a very robust foundation in that course, because even though we're skimming the top, it gets so much deeper. It's kind of like an iceberg, little piece on the top we're going to give you, but it's so big underneath there. But anyway, back to Patti. She is a recognized expert also in medical laser safety. She has held also key roles in the American Society for Lasers in Medicine and Surgery, as well as being the chairperson, board representative, laser safety officer in many of her organizations that she worked. She is a 2-time Nurse Excellent recipient as the principal instructor at Rockwell Laser Industry, and was recently appointed, and we're back again, the twosome here with the Board of Commission for the BLS. Patti has served as the acting secretary for the ANSI 136.3 committee for over 11 years, as well as the IEC. She was recently awarded the James Rockwell Jr. Education Award for her contributions, and it's an honor to present with Patti, as we presented so many years in different situations. So laser safety professionals, medical practitioners, compliance officers, are you guys ready for the status quo? The question is always we get whether an LSO is required and uncover the latest safety compliance and standards concerning lasers, whether they are leased, rented, or owned. It's regulated. You're going to hear both of us say that throughout the presentation. Lasers, like no other device in our perioperative or procedural settings, is a regulated device. And if with radiation safety officers that may be joining this seminar today, they also can concur that a lot of the C-arms and everything else we have are regulated, and the laser is no different. It is not ionizing radiation, but nevertheless a form of radiation. So what are our objectives today? We're going to understand the guidelines, and there's a difference between guidelines and standards. Standards, example, are the ANSI 136.1 and the .3 that belong to what we do. They are standards based on a consensus group, as well as the Canadian standards, a consensus group of experts that help determine the impact of what lasers can do in putting practices in place to eliminate issues. Guidelines are evidence-based practice, and the guidelines can come from all sorts of organizations, from the Association of Perioperative Nurses, from the AAGL, the Association of Gynecological Laparoscopists, as well as the American College of Surgeons. Guidelines are evidence-based practice, and they're not limited to nurses. It could be anybody writing that evidence that's done research that supports the change in practice. We're also going to define the roles and the responsibilities of the laser safety officer. So, do you need a laser safety officer, or used interchangeably a medical laser safety officer? Let's take a deeper dive and find out what are our primary roles and responsibilities. So the Certified Medical Laser Safety Officer, CMLSO, which Patti and I are both CMLSOs, as well as starting to work on the next division or revision of the certification exam, because lasers are changing at a rapid rate. So who can be a laser safety officer or medical laser safety officer? Again, they are used interchangeably. What I do want you to take home is this is an administrative role with authority. And one of my cliches are when you get a letter stating the authority of the laser safety officer for your system or your hospital clinic or your ambulatory surgery, whatever you work in, first thing that I tell people, it is not worth the paper it's written on unless you're given the authority. A medical laser safety officer is a very specialized trained individual for ensuring safe usage of laser in the medical environments, as well as hospitals, surgery centers, dermatology equipment, even veterinarian offices. And this role is defined and guided by ANSI 136.3. It's also the Canadian standards, as well as the Association of Perioperative Nurses. They mirror what that role entails. They are the administrative authority, and the individuals who work under the authority of the LSO become an extension of that practice. Okay, so who can be an LSO? Well, clinical or technical background preferred in healthcare. One of the famous questions I get a lot of times is, do they have to know clinical? All I can tell you is it's helpful, and you can always partner with somebody in the clinical setting and learn it, but they are administrative. Biomedical engineers can be LSOs, radiation specialists, operating room managers, any type of individual who understands that laser technology. But if they go to sit for certification, there is specific criteria they have to hold. So they can be a registered nurse, a medical director, a doctor of osteopathic medicine, surgical tech, biomedical engineer, radiation specialist, and even an industrial hygienist, which I don't see them as much in our type of setting, but they are LSOs also. You must complete a laser safety officer training course. and it has to be offered by accredited providers. So, for example, the course we have coming up is the organization, the Board of Laser Commission. Ours is an approved BLS course. You want to look at that when you're going to register for a course, because there's a lot of courses out there and they emulate what we'll be giving in September, but it doesn't necessarily meet the criteria of what we refer to as an approved medical laser safety officer course. You may be designated by the facility or your employee after proper training and your demonstration of competency, again, from administrative authority. But if you've got that clinical competency, that's just a plus. That way you can not only talk the talk, but walk the walk with the clinical people. So what are the safety obligations of an LSO? Well, they're the oversight of the entire program. They're going to work collaboratively, whether it's with your deputy or your laser safety specialist or your laser safety site contact. We go into a lot of detail of that in the course, but we help to set up proper eye and skin protection, standard operating procedures, and that is not limited to policies and procedures. SOPs may be the generalized setup of the laser manufacturer that you're using for a particular procedure, as well as the delivery systems. A lot of pieces of that come into play and really can create sometimes complications and possible injury to our patients or even staff. You're going to look at controlled access and signage has made a huge transition. We can't go into that granular detail, but signage has made a huge transition over the last year, as well as what do you document? What do you report? What is considered variance reporting or incident reporting? So the expectations and the responsibilities, enforce safety protocols. Develop and enforce safety protocols. And I think so many times I'm seeing hospitals in procedural rooms in physician offices who utilize rental services believe they don't have to have a laser safety officer because they don't own the laser, but they rent it. But they have to. They have to assign a laser safety officer, employ and enforce safety protocols. The laser equipment evaluation. Okay, so you got rentals in, but they still have to evaluate it. But you as the LSO need to assure they've evaluated it. The training and education of your staff, as well as rental or leasing companies. Hazard evaluation and control. If an incident occurs or variance occurs, it's real important that the LSO becomes part of that loop, because a lot of times it may be not intentional, but lackadaisical approach to safety. Oh, I don't need the glass. Someone just turned your head the other way while you test fire. That's important because it helps you measure a benchmark for safety within your facility or organization. And I go on to say record keeping and how you document during a laser course. a laser procedure. And you can't rely on the leasing companies that come in and drop their laser off to their documentation unless it goes through an appropriate forms committee and we accept it as part of our policies and procedures. So the safety program on oversight. Safety program is very different than a departmental policy. The safety program looks at the gamut of the entire system, organization, or practice. So a safety program enforces and complies with all the applicable regulations, standards, and guidelines. Well, who regulates? FDA regulates. Patti will go into a little bit about that, and I got my little badge up there. CMS also regulates, because indirectly, I want to say that indirectly, because when we're not compliant, it affects our reimbursement. That gets it pretty sticky with some of the hospitals. And then you've got ORNAC, but AORN is an international organization of evidence-based practice. And who sits on these practice committees is, again, a combination of engineers, industrial hygienists, physicians, and nurses, and some surgical techs if they're writing. Okay. And then we got the American National Standards Institute, very similar, but we haven't morphed completely, for the Canadian CSA group. Real important that these organizations communicate, because there could be a conflict in what one is saying versus the other, and the IEC. So what are the classifications? And more than likely, unless you're from a university with research, you're seeing occasionally 3B lasers in class 4. And again, in our course, we get very granular on what is expected in regulations and guidelines on these classifications. But as an LSO, you have to know all of these classifications. So the program oversight ensures that every laser used in the facility are properly classified and documented. Biomedical engineer, Bill was mine when the last audit we did at the big system I was at. And I tell the story to the group the other day, how we're going through, and I'm looking and I'm going, Barbara, the manager, I said, what is that laser doing there? I thought we retired it. She goes, we use it for planners boards, just simple things because it's so small. But yet it had not had a preventative maintenance. Biomed, you know what that is. Preventative maintenance was not done. The electrical check was not done. And of course, Bill looked at me like I'm going to have a heart attack. This is why you audit. This is why you have the collaboration, whether the biomed is the laser safety officer or the nurse is irrelevant, is that collaboration together to ensure all lasers used in a facility are properly classified and documented. So hazard evaluation, it comes in all types of forms. It comes when you first set the laser up to get used in a procedure. Do you have standard operating procedures for test firing or assessing beam configuration or assuring the light indicator is letting people know that the laser is in the enable mode, and proper signage and glasses on PPE on every entry access into that procedural or operating room. You assess the environment, the beam path, the exposure to the limits, and what kind of control measures you put in place, because they may vary with various wavelengths. A green light, 180 watt, 532 nanometer, I may be talking Greek to some of you because I am Greek, we cover the windows. Why? Because that color dependent laser can go through clear. Where for the CO2 laser, carbon dioxide, 10,600 nanometers, the glass obstructs, and the optical density or the ability for that laser to go through glass is a 5 at the minimum. Okay. So control measure implementation, as you see here, determines and enforces our engineering, administrative, and procedural controls. And these, again, are the right warning sign. People, you can't put a piece of tape across the door and go laser in use. Oh, you would not believe how many times I've seen that. And you have to have the right signage on the door. It has to indicate that what wavelength is in use, the maximum energy of that wavelength, the PPE in nanometers, as well as the optical density for that specific manufacturer's laser, because it does change. You're going to do access controls to the treatment area. And what does that mean? Well, you know, if you have OSHA come in, they're going to talk the language of our standards and our guidelines. And they're going to say, what are your access controls? And your access controls are the signage in the room. We're not locking the room down. It's the signage. The glass is the indicator light. And ensuring interlocks and key control systems all have to work and function properly, and that's part of the assessment as well as the PMs that our engineers do. Policy and procedure and development, developing written policies and standard operating procedures. There's a big difference between a policy and an SOP, standard operating procedure, where the SOP may tell you step by step what to do, where the policy will give you practice guidelines for safety. When people first take our course that have never had any of this, they get so overwhelmed. And Patti mentioned something the other day when we were talking. Keep in mind, delegation of authority is a wonderful thing. And as the administrative authority over the laser program, you can designate to the educator to help with some of this stuff. So some of the SOPs may be laser alignment, especially with a CO2 that's not using beam gap technology. Or where is the emergency shutoff? Or are you flipping the circuit breaker in the off mode prior to plugging it in? Simple biomedical that's intuitive to your engineers that are at this course here, but not always intuitive to our perioperative personnel or our procedure people, very much so. So incident response is important, and we need to know how to intervene in those situations. Other control let's and see it goes. There we go. Policy and procedure development, and we talked about that emergency response and training and education. This is also a question I get. We get this assumption when you've been validated, for instance, in a specific wavelength of laser, that you can automatically move that over for competencies in other areas. Example, urology to airway. Oh my gosh, very, very different. So your competencies, you should be wavelength specific, delivery system specific, as well as manufacturer's laser specific, because every manufacturer is a little different. And you have to ensure those competencies, classifications, risk, and proper personal protective equipment is in good working order, great working order, since we're talking about our eyes. And this competency should be a minimum of every 5 years for an LSO, and probably more so for your staff that you are providing competency of training and education. And you have revalidation that it should be done yearly on these individuals, just like any other piece of high risk equipment. So audits, conduct regular audits. And everybody goes, how many audits should I have? Well, the standards say, as well as our guidelines, a minimum of once a year. But what if you have a really big laser program? You may be doing quarterly. That's something you need to assess based on the number of laser procedures and the various types of lasers and delivery systems that you have. But conduct regular audits and inspections. And just like you have a checklist for environmental care, it's not as granular as a standard audit, but a checklist works real well by giving it to the validated laser staff and let them go through it and bring it back to you as the LSO. And that keeps them up to date with their standards and practices. Who are our national compliance regulations? From OSHA, FDA, CMS. Remember I said CMS is regulatory when it affects reimbursement, but there are many authorities out there. And we have a whole section of our lecture format for 2 days that talk about national compliance. And one of the questions we've got, but maybe I'll let Linda ask it at the end, is about what states require lasers to be regulated? All your states. But there's more to it than that Patti talks about. Other accreditation compliance, these are the different organizations that affect CMS, which affect reimbursement. And they are laser illiterate. And why do I say that? They take your guidelines and your standards and the OSHA hazard assessment tool, and they cite you because they can't be authorities on everything when they come in. And that is the Joint Commission. Don't ask me to say that Norski Veritas, which is DNV, and it is an accreditation organization for ambulatory healthcare, and that's AAA and Quad A. They all are not as intuitive to the standards and the guidelines of laser. So therefore, they are going to depend on our regulations and our guidance on laser standards. So let me turn this over to my friend and professional colleague, Patti Owens.
Thank you, Vangie. It's been such a pleasure, as I said before, to really have this opportunity to know Vangie, work with her. She's been just an amazing person to deal with. I'm going to go back here just for a second and go forward or to my area. And she's been my mentor, my friend, my colleague, and I just, we're really excited about this opportunity to combine our forces together and 1,000 slides together and come together with an incredible program that we're going to be offering in September. And this is something completely different than the previous MLSO classes that we have offered. And so with that, I do want to discuss some of the subjects that Vangie mentioned previously. And number one, we do have this ANSI standard. We have this Z, it sounds like alphabet soup, it's C136.3. It was published in 2024, and that's for medical laser devices and standards of care. There is an ANSI.1, which is kind of oversees all lasers, regardless if it's entertainment or military, whatever. And then we have, of course, our AORN guidelines, and we have our CSA in Canada, and a variety of other standards and guidelines we're going to be looking at. If you want to go back and research a little bit what we're talking about as far as the MLSO, and you have the ANSI standards or you have access to it with your network online, section 1.3 of the ANSI.3 talks about medical laser safety officers. If you have access to the AORN guidelines, or you know a supervisor in surgery that you can network with, then you want to go into section 12, and there's an in-depth description of what an MLSO is. And both Vangie and I were privileged to be expert subject matter contributors to the AORN guidelines for laser safety that was published in 2021. And you will find a lot of information in this guideline. So with all of that going forward, she did discuss about incident investigation. And if you have that ANSI document .3, you can look at section 6. And if you have AORN guidelines, you can look at section 19. Both of those do describe how to investigate a suspected or actual injury. And for the most part, we're looking at ocular injuries, the eye being the most sensitive organ in the body. The highest rate of complications or ocular injuries dealing with lasers. And so that's what we want to do is look at, hazard assessment, how do we control these hazards, and how do we then create a compliant laser safety program. The first thing that happens if you do suspect an injury, or even if someone is complaining that they have an ocular incident, you want to make sure that you go and follow your guidelines, your protocols, your policies and procedures that you set into place. And this is going to be harmonizing with the ANSI document. And what it basically says is that this individual needs to have a medical exam within the first 48 hours after any sort of suspected or real medical or ocular injury. And that means you need to have this set up in your infrastructure. You need to have your policies, your procedures in place. What is very important to realize is, as we get into this in our course, and you may have had background information from previous training, different wavelengths of lasers can create different types of ocular injuries, okay? The wavelengths that are visible from 400 out to 700 nanometers, those can actually cause a retinal injury to your macula, your fovea, so your central vision can be impaired. Even out to 700 out to 1400 nanometers, the infrared area, these can also cause a retinal injury. And some of these laser wavelengths, it's not going to be immediate. It could take 24, 48 hours, 72 hours. So you want to create a surveillance document. And we'll be sharing that in our course, where you actually then have a complete documentation of demographic information of the individual, the patient, the staff member, the surgeon, whoever had incurred this injury or suspected injury. You're also going to have the ophthalmologist exam, because it does say in the ANSI guidelines that if it's this retinal damaging wavelengths from 400 to 1400 nanometers, they need to be seen by an ophthalmologist. And so that needs to be documented, full fundal exam, everything that they find, what their history is. Do they have history of glaucoma? Are they colorblind? Do they have diabetic retinopathy? All of that will come into place. And then you want to do medical surveillance. Is this a temporary injury, or is this a permanent injury? So that's another part of your program. And then if this is a suspected or real injury, ocular injury, now you have a variance reporting. Now you have an incident reporting. Now you need to actually report this to, let's say, your risk management, obviously any sort of, supervisory organizational structures that you have within your facility, your laser committee, your safety committee. You may need to report it to your accreditation organization, especially if it is dealing with an ocular injury or blindness or death or whatever. You may need to report it to your state I'm talking from California. We have to have reporting mechanisms with the state medical board. And then if it is a result of an actual laser malfunction, okay, now we're getting into a whole different area of reporting. We have to now contact the manufacturer, right? We also have to look at, you know, is this a sort of injury that is a malfunction? And now if it is, we might need to be filling out a safe medical device report. And that would involve within 10 days, otherwise you could have $1 million fine put onto your organization. And then you have to follow OSHA, which is regulatory also. OSHA does say that if you have any sort of equipment that malfunctions, you have this lockout, tagout. So this kind of involves this whole area, regulatory aspects, OSHA, state reporting, also your accreditation reporting, and this is an aspect that you will be responsible for if you are the MLSO or you actually network with the MLSO as a biomedical engineer. The next part is, this is also regulatory. You know, CMS is, which regulates your reimbursement, does mandate that you need to have a very extensive laser inventory for anything that's rented, anything that's leased, anything that's borrowed, purchased, whatever. And this is really important because it has to be designated in your inventory. And this is usually a biomedical, you know, responsible activity where the MLSO can then network with them. They have access to that. They can get on the hospital or organizational network. So this is usually in your area of expertise. And this inventory should include, and we'll discuss this in our class, but the classification of the laser. Is it a class 4 laser? Okay, which is the most hazardous laser out there, which means it could be invisible or visible. You could have an injury from a direct, reflected, even scattered radiation, okay? So classification is important. Who owns this? Data purchase, you know, what's the biomedical number? When was the last time you had an electrical check on it? All of this is going to be in your inventory list. And these have to be somehow earmarked. They have to be highlighted, starred, whatever, as a critical piece of equipment, okay? Because CMS designates a critical piece of equipment as a piece of equipment that if it had malfunctions could cause injury or death, all right? Interestingly enough, the Joint Commission then, of course, went and then wanted to align with CMS, harmonized with that. They also demand that you have an extensive inventory of these critical pieces of equipment, which are your laser devices. And you need to have the same components in your inventory list. Also, which is regulatory within CMS, and now we're looking at the Joint Commission here and some other accreditation organizations, is that you need to make sure that your servicing of these medical devices like lasers are completely compliant up to 100% of the PM and service schedule that's in the user guide that accompanies each laser equipment. I can't tell you, and I know Vangie and I have gone in numerous audits, and I'll say, well, where's your user guide that comes with this device? Well, we don't have it. Well, then how do you know what the safety protocol is? Because it goes through the FDA CDRH. What's your maintenance schedule? That goes through the FDA CDRH before this laser is brought to market. So with all of that, you need to make sure that you are completely compliant with the maintenance schedule. And if you're not the MLSO, you are networking with them, you're communicating with them so that together you can work together so you have this 100% compliance. And then, you know, it doesn't make any difference whether you do the service, you have outsourced it to a third party, or it's the manufacturer's reps that come in. You need to be following this step by step. Another thing that they mandate, CMS, Joint Commission, and other accreditation joint organizations like even AAAHC, they mandate whoever comes and repairs your piece of equipment shows that they are qualified. They've been through a class. They have a certificate of training. And you need to have access to that and give that to the MLSO. And that is an important piece of documentation. You know, as a communicator, if you're the MLSO or, you know, you are the ultimate communicator. You're a communicator with every single person in your laser team and even outside your laser team. All this stakeholders within your organization that come in and out of this laser facility program, okay? You want to make sure that you are communicating, you know, if there's any new procedures, if there is any equipment malfunctions, if there's new regulations coming on board, if there's information from the manufacturer that needs to be then communicated to any of the staff members, the laser users, by a medical department, team members, managers, risk managers, you know, medical staff, all of this needs to be in your, you know, encompassing your communication program here. So this is a really important area. And this is an important aspect with all your team members. You're also a laser safety consultant. And what that means is that every time a new piece of equipment is purchased, leased, borrowed, rented, you need to be informed if you are the MLSO. And if you aren't the MLSO, you need to make sure that they communicate with you, you know, so that you know when this piece of equipment coming in. So you need to know about the electrical checks. So you need to be putting it into your inventory list. So this new piece of equipment that's coming in, as Vangie said, you know, you as an MLSO, you need to conduct a laser hazard evaluation. And we have a whole section in our course, step by step, how you do a risk assessment on each new device coming in, as far as optical hazards, fire hazards, you know, electrical hazards, and even non-beam hazards, which could be even smoke or plume. And so you want to make sure that you mitigate any of these possible hazards that exist. And this needs to be your role as far as serving as a consultant for any new piece of equipment. And also this will apply to any new procedure. You may have, let's say, a holmium laser, but now you have a doctor using that holmium laser, let's say, to use a completely different application, let's say in the spinal cord, or let's say you're doing it for an ERCP. Now you have a completely different location, different team members. Once again, completely different hazard analysis. Oversight, this is also regulatory, okay? As an MLSO, you need to have oversight of all PPE. And I think the most paramount PPE that will be involved is this laser protective eyewear. OSHA demands that the employer provides every employee the appropriate laser protective eyewear. That's in their CFR 1910. Has to have the optical density, which is the filter material, and needs to have the wavelength imprinted on that. So when you do your audit, when you go on site, when you visit every area that lasers are being used, you want to make sure that the eyewear is correct, that's imprinted on there, that's labeled appropriate, that it's stored appropriate, and that it's cleaned appropriate. A lot of people are like, you know, I'll ask, and I know Vangie asked too, you know, how do you clean your eyewear? Well, you know, I take a germicidal wipe and I wipe it all off. That can cause degradation of the filter material that will protect your eye if you had an inadvertent ocular exposure. It can damage your eyewear. So you always want to go back, talk to the manufacturer, get online, look at the IFU, and look, how do you clean this eyewear? So this is really important. And we have eyewear, we have a whole section on eyewear. A lot of our eyewear is multiple wavelength. So how do you know which eyewear is used for which laser? We'll go into that, you know, making sure that they're color coded or labeled or whatever. So this is a really important aspect. And also, besides protective equipment, we're looking also at smoke evacuation, you know, window covers, we're looking at barriers, things like that. So as you know, Vangie said, you know, we have a variety of organizations and non-governmental controls, and we have standards of practice, and we have guidelines that really influence laser use at your facility. Whether, you know, you're a small clinic, and this ANSI document applies to veterinary clinics, aesthetic applications, derm clinics, medi-spas, ophthalmology clinics, dental clinics, obviously ASC and hospitals. So regardless of the size of your program, and we don't care if it's manually brought in, once it's in your facility, whether it's rented, leased, owned, borrowed, it's now under your responsibility. Okay, and then she did mention, you know, the fact that you can delegate. When we get into this two-day course, it can be overwhelming for first-time attendees, but even if you've attended a class in the past, the new standards has changed. ANSI just republished in 2024. A Joint Commission just came out with new survey guidelines, and just this year, we have new guidelines and criteria that are coming out for AAAHC, so it's constantly evolving. So make sure you have people on your team that you can delegate to and help share your role. It's so important. And as I said before, you even in a smaller area, as you may be wearing multiple hats as a biomedical engineer, you may be the safety officer, you may be the laser safety officer, whatever, roles and hats you wear, rely on other people to be your consults to help you, because you may not have the clinical background, as Vangie was saying, and it's important. You may have an administrative background, but you need to have clinical background too. And if you don't have that, then you network and you learn from the people that are on the site that are working with that laser, so that you can now help to perform this laser hazard assessment evaluation and build a safe laser program at your facility. And if you need to, you can contract even with an outside company agency to come in and help you with that. And so if you're implementing a laser safety program, regardless of what you have, as far as your accreditation organization, LSO is a designated and a critical compliance requirement. And you're going to hear us say MLSO and LSO going back and forth, and it's no area of confusion. It just depends on which standard you're looking at. But this individual is a required individual. It's the, backbone. It is creates the infrastructure. It is the quintessential part of your laser program. So what does our course offer in September? We're going to be very unique. We have taught courses for years for professional organizations, and we've kind of compiled all of our 30-some years of laser science and safety and expertise. We're going to bring out every standard we've been involved with, whether it's US or Canada. We're going to talk about methodology to actually conduct this laser hazard assessment. We're going to discuss ethical dilemmas, real world scenarios. How do you deal with the fact if the doctor doesn't want to wear laser glasses during a procedure? You're going to get contact hours. You're going to be able to have access to audit templates, laser committee charter documents, a checklist, timeout documentation, ocular incident reports or medical surveillance incident report, sample policy procedures. This is kind of the timeline where we're constantly evolving. Vangie and I think it's going to be really exciting, the information that we're going to be bringing to you. So regardless whether you're starting a new program or you have a program that's been in existence for 30 years, it's time to go back and reevaluate and retweak, and really to bring it up to the highest standards of practice. And as you can see here, we're talking about all different laser applications, different devices, delivery systems, reporting, establishing the laser safety program, audits, incidents reports. How do you comply? How do you build your laser safety program? Going into job descriptions, staffing, compliance, credentialing, risk assessments, ocular hazards, a big area of that. How to control your laser delivery systems. Lunch and breaks are always really important too. Smoke evacuation. We're now at 19 states that are mandating the use of a smoke evacuation and hazard controls for this occupational risk. And we're moving forward every month, every year in the nation. So if you are not a smoke-free environment, this will be a great place for you to learn the tools so you can make this happen in your facility. Anesthesia is so important when you're a shared airway. And then we're going to have ethical dilemmas, vendors, and this is where you can sign up. We have an early bird registration of $6.95 before August 15th. And this is also an exciting part of our course. And as Vangie said, we have met the criteria of the Board of Laser Safety. So this class if you attend this, this will enable you to use this class if you want to now become a CMLSO. So we're going to discuss that aspect right now.
Congratulations on completing your Laser Safety Officer training. You're one step closer to becoming a BLS, CLSO, or a CMLSO. Certification as an LSO shows your expertise, boosts your credibility, and can advance your career. It's recognized by employers and safety professionals worldwide. To be eligible, you need an approved LSO training course, like this one. 1 year of experience performing the responsibilities of an LSO, a degree or equivalent professional background, and 2 professional references. Applying takes just a few minutes online. Visit lasersafety.org, submit your application fee, then email your application, training certificate, and references to bls@lasersafety.org. We typically follow up within a few days. Becoming a BLS CLSO or CMLSO is simpler than you think, and it's worth it. Visit lasersafety.org to apply and take the next step in your laser safety career today.
Thank you. So, it's really important to now think forward. Some of you have been in this position for years, and this is your opportunity to now become a certified medical laser safety officer. It's not a requirement, and maybe your facility or organization may require it. Nationally, it's not required, but when you become certified, it shows ownership. It shows that you have gone through the didactic, you have gained the expertise. You are now a master here in the area of laser safety assessment, hazard control, and that you are now able to build this compliant laser safety program at your facility. And as you can see here, that the certification is available, and this course will qualify you to take it. This is the QR code. If you want to sign up for our class, I'll get back to this in a second, but I do want to show these last 2 slides showing that yes, we are BLS approved, and this course is sponsored by OR today. And so I know Vangie and I are very, very pleased to be able to be part of this program. So with that, I will get back here to Linda.
Perfect. Great. Thanks, Patti. We've got a few questions coming. The first one is I attended the LSO 3-day intensive course held by the Laser Institute of America. Am I required to renew it every 2 years or not?
Since I'm faculty for LIA, Laser Institute, and Patti is Rockwell, I'll go ahead and answer that question. That is an industrial type of course. Now, what I'm going to recommend to you, it doesn't mean you have to. It is a compliant BLS approved course, but if you are moving into being a laser safety officer over the medical arm, I would highly recommend attending this. This will give you more of the tools you need for a successful course. Patti?
Yes, I went through the industrial course, and as a nurse, it was very challenging. I must say, but it really opened my eyes to the calculations and to all that aspect. But it's different. An industrial course is completely focused on, primarily calculations. The OD, the MPE, nominal hazard zone, different scenarios. When you look at the medical aspect of using a laser device with patients, this is a whole different aspect of compliance and controls. Not only do you have your staff there, you'd have in the room, but now you have your patient, and you are the patient advocate. And so this makes our course completely different.
Leading on another education question here is, what type of education should an MLSO be required to take and how often?
The standards and the guidelines both say a minimum of every 5 years, but I'm here to tell you the technology has evolved dramatically in the different areas. it's then you're going to know your need, especially when a new laser comes on board or if there's a change in the standards. So I would say a minimum of every 5 years or more often. Now your staff, they will have different levels of laser education. You know, we're going to put them through this, but what they're going to have every year is something very similar to any high risk piece of equipment revalidation. So I would say a minimum of every year. Patti?
You know, I really will agree with that because it's interesting. I know that personally, and I know Vangie has done the same thing because we're sharing our slides right now. It is constant evolution of either the technology that's come out or the standards or the guidelines or accreditation organizations or Joint Commission maybe putting out some Sentinel event or whatever that we need to now incorporate in our teaching. And the information, as you know, it's an explosion of information. And really, you know, you could sit back in the past and say, oh, we have this boilerplate policies and procedures. We're just going to slap them right into our laser program. We don't have to think about it anymore. But not anymore. Every single laser has to have a hazard assessment or risk assessment. And that is something completely different. You don't do boilerplate anymore. And so that is why it's really important to know the process and what is now the latest criteria and the latest controls, because you know the safety equipment, the LPE, the standards, everything is changing from year to year.
Okay, so leading on from that, I've got a question saying, if my laser machine is already FDA approved, why should I consider its safety issues?
You know, it's like a car. You know, if it's approved for its safety devices in your automobile, does that mean you never have to put new tires on it? Laser is a piece of equipment. It's going to break down. You have what we call preventative maintenance that is required according to the IFUs and the manufacturer's written instructions. And our standards and guidelines both say that according to the manufacturer's written instructions. And if they say a PM should be done every 6 months or every year, then that's what we need to be putting in place. But there's also assessment protocol that picks that up, even if it's prior to every 6 months, that your laser operator or your laser safety specialist should be doing prior to using that laser on a patient. It's a piece of equipment. It can malfunction and it can break down. And I'm here to tell you it's happened.
Oh yeah, every time we've been teaching these courses for years, and you know, I have experience of an MLSO for 13 years in a hospital, and I can't tell you how many times we had fault codes come up. We had foot pedals separating from the wires because someone would be pulling it out underneath the patient, and after a while, you have now exposed wires. We have you know, hand pieces that have caught on fire. We have fibers that break. We have lasers that fired even on standby. We have lasers that have, which is really scary. We have lasers that have overheated because the staff puts them too close to the wall. These are really high energy source lasers. They have huge capacity of electrical, you know, of storage. And these lasers can get hot. And so now, and also a lot of these lasers have coolant. And the coolant mechanism can break. And 3 times personally, I've seen coolant dripping out the bottom of the laser while they're using it. And you know, water and electricity doesn't really work. So these things happen. Lasers malfunction. So yeah, you bought an FDA approved device, but that doesn't mean anything. You know, it's Murphy's Law, and that's why they have to be constantly monitored by biomed. And also, as Vangie said, this constant assessment by the laser operators that are setting it up, or if it's mobile coming in, you know, this communication back and forth with them and oversight that they've also been maintaining it. That has to be documented also.
Okay, now Vangie, you mentioned this earlier, but where do I find a listing of what states require a laser safety officer, and is there a tracking system online?
That's great. I'm going to do the first half of it. Every state, because it's regulated, requires an LSO. But Patti, you take it to the next level on what else they should be doing per different states.
Yeah, you know, we know right now there's like probably 8 states that really require registration of the laser. And if you have 40 lasers, and of course there's money involved with that, of course, registration of the laser, registration of the medical laser safety officer, you have to submit your certificate that you went through training. Registration of all the laser users, you have to submit the doctor's names and their credentialing. And then you go on further with that. There could be, you know, 20 different agencies that may have oversight of your laser systems. And a lot of them have taken the ANSI document verbatim and made it some sort of regulation that's been promulgated to some sort of Department of Health or Department of Radiation Safety, or I saw nuclear radiation in one state. I'm like, whatever, you know, it is what it is. And so you have to, when I go in and teach, and so does Vangie, we do audits, I have to go basically and Google a lot of this and to really see if are there state regs and rules that will affect this hospital organization. But we will talk about that more and more as we when we go into our class. But it is something to be aware of. States are constantly evolving as far as areas of regulations. I mean, just look at smoke evacuation once again. Another area where now you may have to be complying and showing documentation and audits and compliance. So it is, nothing is status quo. It's constantly a work in progress.
Okay, perfect. Thank you so much, ladies. We're coming up to the end of our hour. So thank you so much for your time today and for such a great and informative presentation. Please remember to visit medicallasersafety.com for more details and registration for the virtual training course on September the 27th and 28th. So any questions regarding the training, please reach out to events@mdpublishing.com. Now, just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download your certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. If you've missed any of our past webinars, please visit webinarwednesday.live to view our whole webinar archive. We'll be back next week with another webinar. So again, please visit webinarwednesday.live for more details and complimentary registration. So thank you once again for your time today, and I hope you all enjoy the rest of your day.
Bye-bye. Thank you so much.
Thank you.